Up next, we have Arun Iyer, the Principal Executive Architect and Field CTO, and Jonathan Alboum, the Federal CTO at ServiceNow.
All right, thank you, everybody. Again, my name's Jonathan Alboum, and I'm the Federal CTO for ServiceNow. And before joining ServiceNow, I had the opportunity to serve as a Chief Information Officer in the federal government for many years. And I worked at a number of agencies, but along my journey in government, I worked at the Food and Nutrition Service, which is part of USDA. And at the Food and Nutrition Service, I worked on the food stamp program and the WIC program, and really all of the different nutrition programs the USDA runs across the country. So I had a little introduction into this broader healthcare topic and in those jobs, and the recognition that healthcare is a big topic. It's complicated. It has, there are a lot of different players and stakeholders through this process. And you know, I bring that perspective into my role at ServiceNow, especially as we deal with complicated topics that cross government agencies and cross levels of government, like healthcare. There aren't simple solutions, and you know, in our environment today, there's a lot of uncertainty around these topics. And to help untangle some of this, I'm lucky to be joined by my colleague, Arun Iyer, who gets a chance to work with ServiceNow customers across a number of agencies, but focuses a lot on healthcare. So we're really lucky to have him today.
Thank you, Jonathan. So again, Arun Iyer is my name. The full name is there if you look me up on LinkedIn, so you get to the right person. But I've been in ServiceNow, in the ServiceNow ecosystem for around 11 years. Various different business models and customers, but I also spent a time in a healthcare company on the back end of things in the provider experience and the member experiences. So that combined with what I do now currently with federal civil and federal healthcare is where I see some of the challenges that we have.
What are the kinds of things that you're hearing from different ServiceNow customers that are using healthcare solutions?
Right. So I do want to go back. Before I get to that, I just a curiosity question. I know we talked about a lot of EHR here, but I do go to one physician. She's actually an eye doctor. She still has paper files. Does anybody have that experience with their physicians, where they still have the paper folders and show of hands? That's way too many. That's way too many. No, the reason I say that is because, you know, we were talking about the challenges that we, find in various different organizations or, you know, in the healthcare space. One of the main things that I'm hearing about in my architect community is what we see the challenges of digitization that has happened, but it is very disparate in levels of maturity, and it really presents a challenge saying, oh, we do have automation or we do have digitization, but things don't talk to each other. And where does this impact? It really impacts in the access to care, the quality of care, as well as the cost of care, and not to talk about even the outcomes that may come out of that. So that's the challenges that everybody that I talk to is saying, okay, it seems like we have digitization, we have automation, but it doesn't talk to each other.
So what are the things that you found effective in trying to bridge those gaps and orchestrate healthcare more effectively?
So I want to kind of present the challenge and how it shows up. In fact, this morning when we were driving into this session, I heard about the number of nurses who are retiring prematurely because of the time that they're spending not in empathizing with the patients they're caring for, but the time that they're spending in actually being the human middleware between different systems that they're using. So there's a lot of burnout, there's nurses leaving, and there's understaffing of that entire area. And oh, by the way, we talked a lot about AI, up to now, but that's one job which is not going away, because that is something that is a human-to-human interaction that we still want, but supported by AI. So that's one of the things that we're looking at.
But so what are the things that you have to do to bring those healthcare workflows together. There's lots of assets out there. We know there's lots of healthcare devices, too many devices in some cases. People lose devices, they don't have control of devices. It just reinforces the idea of silos and lots of data sets that, if brought together, could make healthcare delivery much more effective. Again, what are the best practices you've seen for
Yeah,
bringing-
so I think you kind of reminded me of the whole device challenge that we have. I mean, when you look at a hospital bed, or if you look at what's happening in a clinical setting, there are so many different disparate devices that are providing data and information for the caregivers to act on, but they are, all have their own user interfaces. They have their own data models. They have their own technologies, but there's no way to kind of bring all of that to be actionable. And I think that's where you're going with the fact that if you look at it holistically, all these individual systems need to be brought together in the context of the patient and their experience. And somebody said, how are we treating everybody the same way, with the same kind of medication, not knowing the specifics, whether it's the test results, whether it's the vitals that when you come into a clinic, or whether it's an infusion pump, all of these devices that are around the individual patient and different caregivers addressing that need of the patient, that's where I think you orchestrate and you get away from those being disparate and bringing all of them into a single platform.
So it sounds easy to do. Conceptually it's easy, right? We understand the mechanics of it, but what makes it so hard? Why have so many organizations struggled and had multiple projects to try and do the same thing?
So I think one of the main challenges is that we are not looking at it holistically. I think we take a particular problem and we solve it optimally in just for that point solution. But we need to kind of look at it holistically, and I think that's the point I was making. I think we keep using that word. The humans are the middleware, and they're the ones who understand what this device says and how that reading needs to be interpreted and used versus what the clinical observation is versus what the other device around that same patient needs to be understood. So the workflow that happens is not captured because now we are depending on those individuals who have a lot of institutional knowledge, who have a lot of training, but when they leave, and that's the challenge I presented earlier, now you got to start all over again because you're not captured that into some way to implement.
It can be a lot of manual processes you're describing. It could be phone calls, or it could be emails, or text messages, or a very highly customized approach to get information from one system into another. We just heard, before Indian Health Service, there's not enough people in a lab. They might be inputting lab results into a system. It's a very stepwise process, and that creates opportunity for human error. It creates something of a chaotic environment at times, especially in a large, complicated healthcare setting. So there are definitely best practices and ways to make this less complex. And one of the things I think an important takeaway from this kind of conversation is always to understand how does the data and the work that's a representation of that data, how does it flow through the organization? You look at the sort of digital chaos up there, and there's got to be some set of normal processes that we do when we get this information to get it to the right people to provide the right kind of care. Oftentimes those things might not be documented, or if they are documented, the version documented isn't what is currently how it works. The process has changed. I think there's always this opportunity to step back and think about what are those data flows, what's the data, how does it flow, how should it flow, and be prepared to address the opportunities that are available through tools like ServiceNow, through automation, through emerging technologies like AI, which that sort of a segue into artificial intelligence. We've all been talking about it through this morning, but what are the sort of AI concepts, Arun, that you think are really important for healthcare?
Yeah, so I think I'm going to slightly get on my soapbox here. So I think we all kind of try to think of it, and it sounds like it's a shiny new object that we are all pursuing towards, and a lot of the funding kind of goes towards that. But there are some foundational things that the organization needs to have to even make AI possible, right? And what do we do in some of these places? You talked about data, that the quality of the data is really going to make it useful for us to apply AI or generative AI. I think there was some conversation earlier about, are we doing enough of other things before we get to AI? There are all these disparate systems. Are we connecting them? Somebody talked about robotic process automation. Yeah, that's one way of integrating, reducing the swivel chair needs of the individual, maybe like the nurse caregiver who's looking more at screens than at the patient because of the challenge, spending 45 to 60 minutes in a day. Part of caregiving is this huge administrative and swivel chair overload. So are we doing enough to get the data in a place that it can be used for training and for further use? So there are specific areas that we can use AI and generative AI before we start getting into a place where we are submitting to what AI can do for us. Let me just elaborate that on a little bit. So we talk in terms of AI, we talk about human in the loop, we talk about human on the loop, and we talk about human out of the loop. In the healthcare space, we still are not in a maturity level where we are saying we can go to the human out of the loop. So then coming down one level, we say, can we have human on the loop? We're not even there. I think we should be looking at opportunities where it is human in the loop, which means everybody is talking about, is AI going to take your job? I think that is only part of the statement. It says AI is going to take your job and make it better. And that's where we want to think about how we want to use AI and generative AI. Does that make sense?
Yeah, I think so. I think that there is this conversation we're having about, can you trust the results of what a large language model spits out? And we know that there's some questions that we all have about how do we apply these capabilities inside an organization, let alone a healthcare setting, and trust that the results are accurate, trust that the results are going to tell us the right thing to do. And I'm not sure if we're there yet. And to Arun's point, we don't necessarily know how these models are trained. Sometimes we don't have complete information about the effectiveness or the accuracy of the output. So I think it really comes back to this idea of risk management and understanding what you're trying to do with the models, how those models become the assistant that you're describing, making your job easier. What are the kinds of use cases that we're willing to apply? And within the ServiceNow context, we're very focused on establishing large language models based on ServiceNow data, based on customer data through an opt-in process, based on industry data, and having these very domain-specific models with real provenance around the data and real understanding about how the models are working. So we have a high level of trust about the output. And that output is baked into the workflows that ServiceNow offers. And there's a couple of kinds of workflows that we've really been focused on recently, applying them not just in healthcare settings, but in other industries. And again, tailored around industry-specific data that we have control over. So I'd like to get your perspective, Arun, on a couple of these things and how we manage the risk around things like case summarization, virtual assistants, something we call Now Assist to help you move forward through a process a lot faster.
Yeah, I think you brought a very important point. It also triggers the thought around there's that Executive Order 13960 where it talks about trustworthy AI. So just don't say AI, just don't say generative AI, but trustworthy AI. So pre-qualified saying that if it is not trustworthy, let's not go there, right? And in doing that, what Jonathan just described in the very focused large language models, which are using your data in a secure way, it's not being shared with anybody else. So there is always this cyber attacks on the data itself, which is one way of poisoning what AI can do. So we try to protect all of that. And now we take it to specific items that can benefit your organization. And we talked about the time that the nurses spend in looking at various systems, charting, rounding, various different things, which is not really next to the patient, not really providing that person-to-person care. What can we do in that? The case summarization is a very good example. So if you have nurses switch over, write reports initially and then update it, and then there's a history, and if they have to look that up, there's a lot of time spent in just going through that to summarize what's the next course of action or what is the current situation of that patient, and case summarization does that for you. Again, it's human in the loop. It's not saying that this is the summary and that's it. It gives you the opportunity to read that, edit it, and kind of either validate it or kind of decline what the Gen AI gave you, or actually edit it and say, okay, now I am comfortable with it, right? So
and I think something similar nature, having a virtual agent that has a real conversational capability. It's not a pre-programmed input response, but something that can understand context and then synthesize, look through lots of information. These generative AI models are very good at reading and understanding large volumes of information and synthesizing that into an output that can help someone in a patient care setting or help someone who's providing healthcare move more rapidly through a process, be directed to the right information, or have some administrative tasks taken care for them. Those are things that speed the process along and get people refocused on providing care as opposed to the administrative tasks. So I think things like this, like these concepts, have tremendous potential in healthcare and other industries to, again, as Arun said, to make us a lot more effective. And I think that's part of the future. But beyond AI, there's other technologies, there's other capabilities that are emerging in this space. And you talk to a lot of our customers, you're having deep conversations with them. Where do you think the future is going based on what you're seeing and what you're hearing?
Yeah, so I think multiple speakers and others, as we were talking, have brought up this point that we are going to meet our patients or where they are, which means, are they in a hospital? Yes. Are they in the home? Yes, telehealth. Are we going to go to the workplace and do that? Yes. So more places, more locations where healthcare is going to be provided. That's one. More devices. We're all wearing, wearables. Oura Ring, you have an Oura Ring, and I have a watch, and it's always capturing all this data. Something is going to be done with that data, right? Because that's why we are wearing it, to track, manage, monitor health and others, observations, fall detection, various things. All this data is coming. Back to your original point about the data. So more data, more devices, more locations, all of this is going to happen. And we have to have those guidelines to avoid the risk exposure because, again, this is monetizable. And people are using that for, bad actors are using that. So protecting that data, although there is a spread, that's kind of the future that we are going to be prepared for as we go forward.
So being able to use the data effectively and understand what it means, capture it as part of a workflow, a process, and using automation and AI, create an environment where conceptually healthcare can become a lot cheaper and it can be delivered at the spot that it's needed, to your point. We can move from healthcare to well-care, to be focused on wellness, to be focused on giving me anticipatory healthcare based on maybe what the data is telling me, keeping me out of the hospital. And I think all those things create a really bright future. At ServiceNow, we're very excited to be a part of this, working across a number of agencies in the healthcare space and really across at the federal level and at the state and local level, and worldwide and across commercial healthcare. So we're excited to be part of this journey. Thank you for your time today. We appreciate the conversation and look forward to continuing it during the rest of the day. Thank you.
Thank you.